I'll bless the Lord at all times, and his praise shall be continually in my mouth. Brother Brandon O'Doy, Assistant Minister of the Hope Church of Christ. We want to welcome you to our Community Care Conference. We are just pleased today to be able to come to you and to present to you what we think will be a blessing to help the church as a whole to be able to have real, relatable, and reliable information concerning the COVID-19 pandemic. We are children of God and children of faith, and we're putting our faith and our trust in God, counting on him to do what no one else can, which is to usher us through these turbulent times. And we're just so blessed to have gifted individuals in the body of Christ who have reliable information that they have gained in their spheres of influence based on many years of academic study. I want to introduce on tonight Sister Roxana Dunn, who is a social worker, has a master's and so many other degrees. I'll let her introduce herself. And then also Sister Dr. Trudy Gallard, who works at the university and has the ability to teach those who are in the nursing field and so many other credentials. We've chosen these two sisters to be able to come together weekly to share with us the information that's so critical and crucial even at this extraordinary time, not only in our Christian faith, but also in these United States of America. And so as global citizens, the most important thing we want to try to figure out is how should we be looking at COVID-19? What can we do to prevent it? And then also, if we do contract the virus, where we can go for resources in Dade, Broward, and even Palm Beach counties. I want to thank you for joining us, and on behalf of our Senior Minister, Brother Alvin L. Daniels Jr., this is the Hope Church of Christ Community Care Conference. I'd now like to allow Sister Dr. Trudy Gallard to go ahead and present on tonight, and she has some very informative things to say as it relates to the medical side of this pandemic.
Good evening. Thank you, Dr. Doyle, and thank you, Brother Daniels, for your leadership. I'd just like to share some general information with the congregation tonight about the COVID-19 or the coronavirus. And basically, our goal here is just to give you general information about what it is and give you some resources, like Brother Adoy said, where you can go for help. I'm going to share my screen because I prepared some slides today, and I'm hoping that this is going to work. So I'm going to share now, and then you let me know if you're able to see it. Can you see my slides?
Yes, we can see it perfectly.
Okay, great. Gonna open it up a little bit. Let me move you guys down or out of my way. Okay, so what actually is the COVID-19 virus? Well, as you have probably heard by now, it's really a common virus. We're actually up to the 19th strand, so it's been around for a while. This virus is a viral infection that affects your nose, your sinuses, as well as your upper throat. As with most viruses, you get them by the same way you get a common cold, by being with somebody that's infected, they cough and sneeze, and you inhale some of the droplets. Touching an infected person's hand or face, or by touching doorknobs or something that an affected person has come in contact with. These are three of the common signs of the COVID virus. Actually, for some reason, I'm going to stop sharing my screen with you. Okay, I messed up. So basically, some of the common signs are fever, cough, and a runny nose, as well as shortness of breath or difficulty breathing. Now, I'm sure you've come in contact with people that have had a lot of these signs and symptoms within the last couple of days. Doesn't mean that they have the virus. They could just have a common cold. Now, what makes the COVID-19 virus a little different from the common cold? It's really hard to tell the difference between the two. They both share some of the same common symptoms. The difference really begins in when do you really start to exhibit those differences. One of the problems with the COVID-19 virus is that you can have symptoms for about 2 to 14 days before they get severe enough that you actually would seek attention. Whereas with the common cold, when you get sick, it's a little more the symptoms usually occur in about 2 to 3 days. Sneezing is common, as well as coughing is common, and a runny nose is common. When you get a common cold, though, you don't get shortness of breath. So that's one of the major symptoms that would alert you that it's different. Aches and pains are sometimes common, as well as a headache. So if you're trying to distinguish whether you have a cold or the COVID-19, really look at these and think about, are your symptoms different than when you've had a common cold? Now, what's one of the problems with the COVID-19 virus? There's actually no treatment. So those of you that are sending email messages and Facebook messages to say that they found a cure or some type of treatment, none of these things have been guaranteed. They're all right now under development. Recently, there's been some discussion whether one of the anti-malarial drug, chloroquine, can actually treat COVID-19. It has not been determined. So please, if you have any of those in your cabinet, do not take them. So what do you do if you're sick? Well, if you're sick, you should really stay home because you don't want to infect anyone else, but you should alert your healthcare provider. If you don't have a healthcare provider, you should contact your local health department. You should get tested. Every health department, every physician's office has a screening tool that they will go through a series of questions to see whether you actually have enough signs and symptoms to get tested. Remember, currently we don't have enough testing kits for everyone. So everyone that has a sneeze or a cough, they're not going to get tested. They're going to look for other symptoms like shortness of breath and a fever. If you are sick and you're living with other people, try to isolate yourself because you don't want to infect everyone in your household. So disinfect, wash your hands, use bleach, make some type of cleaning solution that could make the virus, hopefully kill it. Wear a face mask if you have one available. If you don't have a face mask, get a scarf and tie it around your nose and your mouth so that someone else doesn't inhale the droplets that come out of your face. And as I said earlier, don't share your personal household items with other people. So what can you do not to spread the virus to other people? The most important thing that you can do is wash your hands. You need to wash your hands often, wash them before you eat, wash them whenever you touch a surface like a doorknob or a handle, wash them whenever you go out of your house and you come in contact with people that you're not aware. Use a hand sanitizer. Carry some hand sanitizer with you. If you don't have hand sanitizer, a 70% alcohol solution is good enough. And if not, be like my mom or my grandmother and make your own bleach solution. If you cough or if you're sneezing, cover your mouth and your nose. Use the elbow so that you don't spread your droplets in the air for someone else to inhale. Use a tissue if you have to blow your nose and discard it immediately and wash your hands right after you are done with that activity. The other thing that you need to do is avoid touching your face, touching your eyes, touching your nose. These are the things that take the virus from a surface to you. So avoid touching your face because that's the most common way that it spreads or gets to you from another person. And Don't shake hands. Right now, we're practicing social distancing. So give people a fist bump. We're not supposed to be hugging. Use the Wakanda greeting where you just acknowledge people, or be like we used to do in the old days. You just nod your head and say, how you doing? Good morning. You don't actually have to touch anybody at this time. And I think everything happens for a purpose. Right now it's springtime. It's time for us to be cleaning our house. This past week, I've taken a lot of time to clean down my entry door to my house. I also have my can of Lysol. If anybody enters my house, they're getting sprayed down before they enter. Just precaution. Then I put this slide in to really explain what social distancing is. Right now, we are just at the tip of the iceberg of the potential of what this virus can do. As you may have heard, the numbers keep increasing. Currently in the US, we have over 138,000 confirmed cases. We've had over 5,000 deaths. That's going to get more. But if we want to decrease the spread, we really have to stay home. We cannot congregate with big crowds of people, and we should avoid being with masses of other people that we don't know. If you have to go to the grocery store, to the store, practice maintaining a distance between you and the next person. We recommend about 6 feet, and that's enough distance that if somebody would sneeze, hopefully their droplets don't carry that far. The other thing that this slide shows, if you look, the first bell curve basically shows this is how we're constantly getting more and more cases of the coronavirus. As we do more testing, we're going to get more people confirmed, but not everybody that's confirmed is going to get sick. So the best thing that you can do at this date and time is really stay at home. So, and staying at home, how do you cope with these social limitations? Just because we're practicing social distancing, it doesn't mean that we have to isolate ourselves from other people. This is a good time to use those wonderful cell phones that we have. Call a neighbor, call a friend, call your parents, call someone that's elderly. See if you can run an errand for them because they cannot do it themselves. And try to disconnect yourself from the news. Some of us like listening to the news all the time, and right now it's always negative. It's always more cases. If those things make you depressed or sad, turn it off. Disconnect yourself from that. Try to get the information that you listen to. Make sure it's from a reliable source. Don't believe everything that you get on the internet, as well as all the things that your friends give to you on Facebook. Try to create a routine. Just because you're at home, and if you're home with your children, it doesn't mean that they should not be doing their homework. They should have at least 4 to 5 hours of study. We should make sure that they do that. Get out of bed. Make sure you're doing your Bible study. It's a great time to commune and get your prayer life together, because God is able to take us through this. He's taken us through many things before. Maintain a healthy lifestyle. Just because you can't go outside doesn't mean you can't walk around your house. You can't go in the backyard and play some games with your children, or you can do some exercise in place. We have a lot of apps on our phone where we can do some strengthening exercises, we can do some stretches, and we can do a lot of things right within the comfort of our home. And don't spend all this time eating snacks. Remove them, take them out of your way. My next colleague is going to talk about ways to manage stress. But in this time of need, we should really try to stay positive, because that's going to be the only thing that gets us through this. So if you need help, where could you go? Well, the Department of Health has set up a COVID-19 call center. It's available 24 hours, 7 days a week. The telephone number is 866 779 6121. They're available to answer all your questions as well as tell you where to go for testing. Some doctors' offices actually have the test kits there. And then I'll share with you some screening sites within Broward County and Miami-Dade County that are doing free testing. So this slide shows the testing site. C.B. Smith Park has a drive-through testing. They're located 900 North Flamingo Road, and they're open from 9 to 5, Monday through Friday. Cleveland Clinic also has a testing site. You have to call and make an appointment to go there. The Festival Flea Market on Sample Road also has a testing site, but you need to make an appointment. And the Hard Rock Stadium here in Miami-Dade County also has drive-through testing. You have to call the health department to get on that list. So that's just basic information. What I neglected to tell you is who's at risk for getting the virus. Well, we know older people, those people over 65 years of age, are most at risk of getting the virus, as well as those individuals that stay in senior living centers. That is why our governor has limited visitation to all the senior citizens. Those people with chronic health diseases like chronic lung disease, diabetes, kidney failure, liver disease, any patients that are taking steroids, or any people that are under management for cancer or chemotherapy. Those people have compromised immune systems, increasing their risk of getting an infection. And finally, pregnant women are at increased risk. So they should avoid a lot of contact with people, with the environment, and try to stay inside, as well as those people that are actively, like I said before, under chemotherapy or for cancer. So we all should be diligent in how we choose to go out. If we have to go out, we need to wear a face mask. If we don't have a face mask, we can take a scarf and protect our nose and our mouth. And we should also wear gloves. And once you've gone out, before you come home, you should discard those gloves, so that if there's anything that you've touched, like a shopping cart or a door handle, you will put that immediately in the garbage, and you don't bring the contents of that virus from the outside into your home. That's all I have to share with you at this time, and I encourage you all to be very safe.
Okay, thank you, Sister Trudy Gillard, and we appreciate your expertise. We're gonna postpone questions to the end. I wanna immediately go to Sister Roxana Dunn and give her the opportunity to talk about coping and some of the social science things that you need to keep in mind as it relates to COVID-19, this pandemic. Just, some of us can get anxiety. So I just definitely want to give way to Roxana at this time.
Hello. Hey, everybody. This is Roxana Dunn. I'll be talking about managing stress and anxiety during a national crisis, which is what we're going through now, the COVID-19 or the coronavirus. And I just wanted to shed some light on these emotions that we're feeling at this time. So I have this slide that says, take what you need. Take whatever you need today: strength, courage, love, patience, perseverance, peace, joy, acceptance. I want you guys to take what you need. It could be more than one of these things on here, but I'm gonna hold on to this right quick and let you guys pause and take what you need really quickly. Then we can move on to the next slide. Okay, so stress in the body. Like Dr. Trudy was saying, that some of the underlying symptoms or signs of COVID-19 could be the signs of the flu. But one thing I really want to talk about is stress in the body today and how we are reacting to this particular stress with COVID-19. So let me just emphasize to you that we're all in this together. You're stressed, they stress, we stress, we're all stressed. So we're kind of all in this together. And I want everybody to remember that we're going through this as a family right now. And so take whatever time you need to take care of yourself first and foremost, because the fact that we're going through this coronavirus right now in this day and time, it's unfathomable for us. So just as coronavirus has some symptoms, stress in the body, stress plays a role in the body as well too. So as I'm looking over this sheet, if you look over the body parts, especially when you go to the immune system, I'm looking at more frequent illnesses such as colds. Illnesses last longer and feel worse than usual. So one thing that I know is that when our body is going through a stress, it reacts differently. So one thing that they emphasize on with going through this is to build the immune system, because what you feel like or what you think may be a cold or you coming down with the flu or even signs or symptoms of the coronavirus could be the body reacting to stress. And if you look at the head and mind, it starts with confusion. You're having trouble finding your words. You're fatigued. You're dizzy, headaches, jaw pains, fidgeting, dry mouth. So as I'm looking at some of these symptoms of stress, they're somewhat identical to what the coronavirus is. And I'm here today to kind of ease the stress and anxiety that you're going through and tell you that sometimes it's not always what it seems. And if we just take the time out to really take care of our bodies and really listen to our bodies and understand that it's not working against us right now, but it's just our body way of processing the stress that we're going through. So digestion, stomach ache, heartburn, nauseous, food cravings, constipation, diarrhea, cramping, indigestion. As I said before, if you look at all of these symptoms, they're almost identical to the COVID virus and what it looked like or what a common cold should be. So as we're going through this together, I want you guys to just identify and know when your body is going through stress and how to identify the signs of anxiety. So I know within the past 3 weeks, I haven't been sleeping so well. I know you guys haven't been sleeping well, or you've probably been oversleeping, or you undersleeping, or whatever the case may be. But some signs of anxiety is the hypervigilance, always jumping up, you're anxious, you just always on the attack. For example, my sister had somebody come to the house and she sprayed the person down with Lysol. and and while I hear that, don't spray people down with Lysol, y'all. It's unsafe to get on the skin like that. So I do feel that. I do feel it. I do. Restlessness, the inability to sleep. So within the past few weeks, I know you probably noticed that you've probably been binge watching for one, and you have not been able to sleep because this is on your mind. And on top of what's on your mind with the COVID-19, we also have money on our mind. We have our works, we have our day-to-day lives, we have our children, we have our health, we have our parents. We have a lot of things that are going through our mind right now. So for right now, for COVID-19 to just come in and just dump this on our lap, it's just one more thing that we have to deal with. And not only so, it's life-threatening to some, and it's life-threatening to most. And let me just say this coronavirus is real. There are people who I know, people who passed away from it, people who I've spoken to online who has it, and people who I know who's overcame it. So it's real out here. And I want y'all to understand that regardless of what we're going through, we're still all in this together. And we deal with so much on a daily basis. So at times it's going to feel like a lot because it is a lot. But sometimes we just need to just take that time out to breathe and actually let things go and know that things will get better. Some other signs are racing and unwanted thoughts. You may have had those thoughts, oh my gosh, I got a cough. I got coronavirus, or my throat itching, or, you know, I see the memes going around and stuff like that. Don't let these memes and everything else fool you, because for one, just know that you are what you think. Whatever you thinking and whatever you put out there in the industry, the universe, and the world, it comes back to you. So think happy thoughts, think positive thoughts. So things that I can do to help manage my anxiety and stress. So if you're not on medication, and this goes for everybody who takes medication, whether it's for high blood pressure or diabetes, stay compliant with your medication. If you are one of those individuals, who deals with anxiety and depression and stress, stay compliant with your medication. Now is the time to take your medication and not slack, and also to keep in contact with your behavioral health provider. Other things that you could do to manage your anxiety and stress is to do relaxation techniques. Take deep breaths. You can also stretch. You can also do exercises, meditate, pray, and engage in activities you enjoy. Some apps that I have that I use to keep me calm through this time is, I have an app that's called Calm. If you have an iPhone or smartphone or whatever the case may be, download these apps and they help a lot. Peace, one that's called Peace, and it's another YouTube channel that I use. It's called Yellow Brick Center. And the next thing is to unplug. One thing I notice that people do is they get up early in the morning, they looking for the coronavirus update. I'm going to tell you just to stop. Stop it. Just stop it. Turn the TV off, put the phone down. The first thing that you should be doing when you wake up in the morning is just giving praise. Giving praise, pray, meditate, whatever you need to do, because putting all that negative energy in your mind the first thing in the morning, that's what you're going to have on your mind the whole day. So you need to unplug. Just have some days when you just don't watch the news. I've put myself on this schedule where I watch the news every other day, because for one, once I wake up watching the news, I want to continue to watch coverage and see what's going on. But I had to unplug that because it started feeding into my soul. And I'm like, I don't need all this negativity in my life. And unplugging doesn't necessarily mean the news. You can unplug from people. I mean, I know people who will talk about coronavirus all day, send links and stuff like that. And I have to put my phone in airplane mode, because I get all of these alerts, and I know you get these alerts too, where 900 people died in one day or 300. You're like, oh my goodness, it's overwhelming. It's a lot of information to take in. And so you have to unplug from people, unplug from social media. I know Facebook has a banner that shows a whole COVID-19 update report. You have to unplug because it's good for your mental health. It really is. And also, educate yourself. If you don't have the clear communication or to talk to someone, because different news outlets and different sources, they report different things. Call your doctor and ask your doctor what's going on, or just call them to educate yourself. And not only that, go to a reliable source. Some sources I can name is like the CDC, SAMHSA, different government sites that provide you with valuable information. The next thing you want to do is just to stay connected. I know we have FaceTime, we have Skype, we have WhatsApp. Stay connected with family and friends. Now is the time to really connect. And although we have some vulnerable individuals in our lives, sometimes we cannot physically connect. We can do it socially. So I know you guys been on Instagram, and you guys been doing the quarantine party with DJ D Nice and everybody else. So those are other ways that you can stay connected as well too. I mean, if you have to turn on YouTube all day and just listen to a relaxation channel, I mean, that even works good for you as well too. Next thing is to talk about your experience and feelings to loved one and friends. One thing that I can honestly say is that it's okay to admit to people that, I'm afraid of what's happening, Once you talk those things out and you let those feelings go, you learn that you're not the only person who's afraid. And sometimes we get into our own little funk and we feel like we're the only person who's dealing with this and no one knows what we're dealing with. And no, we're all in this together. I'm sure the feelings that you may have had, I've had them. Dr. Trudy had them. Oh, Doy may have had them. It had crossed our minds more than once. But what I'm going to say is to talk about your experience, but also keep in mind and maintain that a sense of hope and positivity. When we maintain that hope, we know that things are going to get better. Things happened like this in the past before. So we know that there is hope and there is a God who sits high and looks low. But keep that hope and still hoping to everybody else. Even when I'm not feeling my best, I'm always calling somebody to encourage them and have a positive word. But you never know what your word of hope or your inspiration can do for another person. And lastly is to maintain social distance criteria. We can't emphasize enough social distances. We're practicing it every day. We're practicing now, in the church, in the stores. Just maintain that social distance. If you don't have to go anywhere, don't go. And one thing that I'm going to share with you guys that I share with my dad or anybody else who's elderly in my family, if you don't have to go to the hospital, do not go. Because for one, they're overwhelmed with so many things that's going on. Telemedicine now, do a video chat with your doctor and talk to them and say,